most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course,
Imagine
Bob.
that, Brad sleeping on the job. Today we're going to talk about how to sleep in a recliner with back pain or sciatica, etc. Because there might be other reasons you're sleeping in a recliner.
Sure,
Sometimes people
sure.
just do to have their legs up, or I don't know what they're doing, but they do it for different reasons.
Right.
By the way, if you're new to our channel,
right.
please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, you want to join us on our website, bobandbrad.com, because we're always giving something away. What it is, we don't know, because this is a future video.
But
If we could look into the future, we'd know.
exactly. Look on our website and they'll...
Or look on Facebook.
Oh,
It'll be
yes.
pinned to the top of the page to give away. Sometimes we're giving away really cool stuff like a Sleep Ovation mattress. The other thing you want to maybe try is Instagram or Twitter or TikTok, because we do a 60-second version of our program every day.
That's right.
So our first advice with sleeping in the recliner with back pain and sciatica is don't do it.
Right. There typically is nothing but bad going to come from it. But there are some things, if you really want to, that we're going to show that's going to make the bad things minimal.
Right. The problem with if you're sleeping in a recliner, it's still somewhat of a flexed position. And even if it feels better, you're kind of teaching your body to be in that rounded out position. And it'll carry over to your walking, you're going to get more bent over. Having said all that, however, we know there's people that just literally could not sleep unless they're in the recliner. I mean, I've had people like they're in so much pain lying down on the
Right.
bed
Yeah.
that and you need sleep. Sleep is more important than the recliner versus the bed.
Exactly.
So
And there are some cases with some back pain, like if you got stenosis, that's understandable. But if that's the case, listen up to show us what the options are, so it's going to minimize things from getting worse over time.
the first thing you might want to try if you haven't been able to sleep in bed is actually trying to sleep in bed with a wedge.
A leg wedge, and we're going to show you what that is.
Let's do that right now, Brad. So you can grab one of your pillows there. The reason this is, it's kind of almost similar to sitting in bed, isn't it, Brad? I mean, to some extent.
It does put your hips similar position to the
You see what's
recliner.
happening here? Now your hips are kind of flexed like they're in the recliner. And I've had people that if they slept in the recliner, we were able to transition to this, go
Right.
back to this. And I've had some people that it still didn't work. And so, I mean,
Right.
we don't never know.
And if it is successful this way, after a while sleeping like this, a number of days or weeks, they can transition back to normal sleeping.
Or maybe a couple pillows.
Sure.
Underneath.
Yep.
So-
underneath the knees.
So these are leg wedges. They're only like $25 or $20
Right.
depending, and some of them are a little bit longer, and some
Sure.
are a little bit higher, and so.
Right.
But it's worth a try. It's a comfortable position for a lot of people with back pain. All right. So if you have to be in a recliner, do you want to be the recliner person today,
Yeah.
Brad?
So first of all, you want to have your legs up. So
Right.
and most people appreciate that and like that anyways. And once you're here, we advocate not sleeping this way, but actually taking the recliner back so you're back as far as you can, and hopefully you can tolerate that.
Right. You want to be as flat as you can. Now, the thing that we want to add in this position, though, is we want to give you some back support.
Right.
So there's a lot of different ways you can try this. One is you can just try a throw pillow and put it in your back, and that's going to help put that arch in your back and kind of prevent that rounding out from occurring as much as it normally does when you're in a recliner.
Right.
In the recliner, it's dependent on you, how big your curves are.
Right.
It depends on the recliner, how soft it is. It's all these different factors. That's why we can't really tell you which thing to try.
All right. This feels a little bit big for me. This is a firmer recliner, actually. So, but I've had patients that they had old recliners and they were just literally wore out, and they would put a full pillow
full
on like
pillow,
that just
yeah.
to take up the worn out space of the recliner.
You might get by with just a rolled towel there, Brad.
Yeah. And now this support is obviously more specific. It's going to support where it is and not so broad. that may or may not be good for you. You'll know because when you put it in there and you lean into it, it's going to feel good.
This
That's
is an
what we're looking
experiment,
for.
this whole thing. You
Yeah.
may take a towel, a larger towel and roll it up, or you may take a small towel and just fold it. I
Sure.
mean, there's a lot of different options. If you eventually find something that you like, you might even try something more permanent that you
Right.
can use in your car and seats. But Brad, you tend to use this one right here, right?
Yeah, this is exactly what I use in my recliner. This is for me, it's too round. I've got spondylolisthesis, which is different than sciatica. But this works good. It's a memory foam. It gives me support from my sacrum up to my mid back. And I really like the memory foam aspect because you sink into it and it just supports well for me.
For you, that's
for
what we want to
me.
say, because there's going to be a lot of people, if you try this, it may not work for you at all.
I'm going to say a lot of people that use this, they say, oh, it feels too big.
Right.
It did for me a little bit the first time I used it, but then after I let myself sink into it, it's like, oh, this is good. So I wish we could.
Yeah,
say
find the
this-
one that's going to work for you for sure. But we just can't. I
Right,
mean,
we're
it's
just being honest. We're not.
so. And what you also want to do along with this, believe it or not, is as much as possible, is especially if you have to go out, get up and go to the bathroom or something like that, walk a little bit, because
Right.
it's always good to break it up and not lie down for too long a time
Right.
when you have back pain, especially in a flexed position.
Yeah, so those potty breaks in the middle of the night work out to your advantage.
There you go. Just make sure you have a night light on so you're not falling or stumbling.
Oh, I got a story about that, but we don't have time for that.
All right. I can't wait to hear it. So Mackenzie has a bunch of different rolls too that you can try, especially if you're thinking about your car or your office chair.
Sure.
But give that a try. Like we said, if possible, avoid it. But if you're stuck with it, make the best out of it.
There you go.
So thanks for watching.